Medicaid, as we're discussing today, is the primary payer for long-term care here in the United States, covering about 61% of total spending. It's the backbone of our long-term care system, supporting millions of seniors and individuals with disabilities, as well as the dedicated professionals who care for them. But let me be clear, despite some mistruths circulating from my colleagues on the other side of the aisle, the impacts of the 2025 Budget Reconciliation Plan, I call it the Screw America Bill, are indisputable. House Republicans are proposing to slash $880 billion from Medicaid and eliminate critical tax credits that help working families afford their health care, all while delivering a $4.5 trillion tax credit cut to billionaires, to big corporations, and to tech tycoons. The consequences of these proposed cuts are not hypothetical. They are catastrophic. Any cuts to Medicaid will only intensify the existing challenges in the long-term care sector. Direct care jobs will become even harder to fill, further straining the system. Providers will be forced to reduce workers' hours and in some cases shut down entirely, destabilizing the long-term care workforce and undermining health care quality. Workers themselves will be at risk of losing their own Medicaid coverage and other essential supports, further plunging them into financial instability. Now, my constituents are very concerned. Just this past weekend, I held a town hall to give an update on what's happening here on Capitol Hill and to listen directly to my constituents. The first question from that town hall: what is being done to protect workers in nursing homes from Medicaid cuts? That is not an abstract policy debate. It is real. Real workers, real families, and real lives that are on the line. Mr. Carlson, my question is simple. If $880 billion in Medicaid cuts become a reality, what do you anticipate will happen to the long-term care workforce?
If cuts were made of that magnitude, then long-term care providers couldn't operate the way they can now. You can imagine closures because of the prevalence of Medicaid to fund long-term services and supports. Drastic cuts to Medicaid would first, the consequences fall on the state, which is unable to make payments that are necessary to maintain the system. And then the consequences fall on the providers because they no longer have the funding to provide necessary services on an individual basis, on an institutional level. A lot of nursing facilities and also home community-based services providers rely extensively on Medicaid. 50% of the reimbursement, 2/3, depending on or above, if you're talking about some home community-based service providers. They just couldn't operate any longer.
So knowing that reality, what should lawmakers be doing right now to protect these workers and to stabilize the critical workforce that's needed in healthcare?
Yeah, well, on behalf of Justice and Aging, that the urgent issues in access to post-acute care at the topic of today's hearing is protecting the Medicaid program, in rejecting these cuts, in recognizing the importance of Medicaid and maintaining the current funding and structure of the program.
And this is the fact that even before this House Republican reconciliation proposal was made, families were long voicing concerns about the quality of care in nursing homes, especially the lack of adequate staffing to meet residents' needs. In fact, in 2024, the Centers for Medicare and Medicaid Services took action and set minimum staffing standards to ensure that every facility has a nurse on site. Research from the University of Pennsylvania shows that the rule improves care quality, reduces abuse, and saves an estimated 13,000 lives annually. But now Republicans have indicated their desire to roll back these critical protections once again to fund tax breaks for big corporations and the wealthy. So how is rolling back protections and standards going to improve quality, Mr. Carlson?
Again, the position of Justice and Aging is that it's counterproductive. I'll note that this has been a problem for decades, that the standard of the federal government has just been sufficient staffing, which hasn't been enough to establish a decent quality of care. And you can talk to individual nursing facility residents and hear stories all day long about just not enough staff and how that leads to bad outcomes and a bad quality of care. Just point out, the standard, there's a phase-in period, right? It hasn't even come into effect yet. And so what we would advocate, of course, is that let these standards be implemented. They're important. There are accommodations to allow for changes under certain circumstances, and they should be maintained.
Thank you. I yield back.
Mr. Costa.